For 20 years, stroke was the first cause of death in Brazil. We didn't have anything to treat stroke patients, so we started in the last 10, 15 years with the stroke neurologists and now other health professionals to implement acute stroke treatments, stroke units, and to create a national stroke program. We have a lot of success, but we have several challenges. One of them is really we have overcrowded emergency rooms, and we didn't have doctors trained to assist these patients, and now we have. SAMU is our pre-hospital. Since 2008, SAMU is integrated in the National Stroke Network, so they are very well trained to assist stroke patients and assist fast and take the patient to the right hospital.
Então, essas intervenções de conseguir colocar o paciente certo, no lugar certo, no tempo certo, principalmente ligado ao AVC, ao stroke, ao infarto e essas condições agudas que determinam vida ou morte, ou sequelas graves, ou quase ausência de sequelas, se bem manejadas, elas são muito importantes para integrar no sistema de saúde.
We have areas without neurologists, and we launch a new program. We are using an app, so the specialists can discuss the case, and the other residents can give opinion, and you can see the results, and you can integrate the whole team.
Em grande parte das grandes cidades brasileiras, uma rede de cuidado agudo do AVC, que é exemplo para qualquer lugar do planeta.
We increase 3 times the chance of patient be normal. We increase 2 times the chance to be independent for the daily activities. And we decrease the mortality and severe disability. And now we have the first developing country that proved that treatment of stroke can be done and is cost-effective in public hospitals. It's improving a lot stroke care in Brazil, but still we have 400,000 strokes and more than 100,000 deaths. We are much better than before, but it's not enough. We have several campaigns for the World Stroke Day and World Stroke Campaign. A few years ago, we launched Running Against Stroke because the exercise can decrease the risk of stroke. We have campaigns inside the stadiums with football players. We can reach in one game 4,000 people. We have 10 main risk factors. These 10 factors can represent 90% of cause of strokes. In order to reduce the risk, we will use stroke riskometer app, polypill, and health community workers. Riskometer is an app created in New Zealand with an evidence-based score to evaluate the risk of stroke. You can see how to modify your risk, increasing exercise, decreasing weight, improving diet. We really believe that we can cut stroke in half with this program.
Se caso o papai ele tiver com a boca torta, com o braço sem força, não conseguindo falar, o que tu tem que fazer se tu estiver por perto?
Now we have a new campaign. This is an international campaign for children from 4 to 8 years old, teaching about the risk of stroke and with games, how to know the stroke signs and how to call the 192, that is our national ambulance. The name is FAST because we have to arrive very fast in the hospital to decrease the risk. So the children now can be heroes and safe to the grandparents. We can really change the system, the whole stroke system of care, working together with doctors, nurses, and students and residents. And I can see that you can change people's lives with this work.